Can you imagine 10 cosmetic procedures in one day? It's really extreme, but that's what Heidi Montag put her body through. Well, now it's 6 years later, and the actress now admits that she regrets it. Well, Dr. Clark, can you put that bad message back in a bottle?
You know, it's a really hard issue because we see many people having plastic surgery to gain attention. We have a lot of people getting plastic surgery because there's other issues going on in their life that make them unhappy. And I think she's a great lesson that everybody needs to learn. There is a lot of happiness that comes out of plastic surgery. There's a lot of healthy improvement in body image. And then there are people that become somewhat of an avatar of themselves. Things just don't look right. And you know, I think you've taken a very fresh, beautiful woman and made her look like she's had plastic surgery. And I don't think that's what plastic surgery is all about. Do you think, Bruce?
Well, no, and I think it's a matter of extremes. You know, we could see this in just about anything, but you can take something good and push it to limits that, you know, really don't serve you well. And
How do you determine where that line is?
Well, you know, that's a good question. And is it the patient's choice? And what responsibility do you and I as a surgeon have? I mean, you know, I tell patients sometimes, especially when coming in for a breast aug, you know, you're like kids at Christmas. You know, I want some new boobs, and we're supposed to be the adult in the room to help guide some wise choices and hopefully keep them out of trouble.
You know, I think it takes an artistic eye to see when you've pushed the line from a facial realm. I think you and I have had a lot of discussions about when you go over the line with a breast size issue. It's hard, and I think it's hard to teach, because I try to teach young plastic surgeons this. When have you crossed the line from a facial aesthetic standpoint?
Well, but the other, you know, the other component, to your point, is that patients will drive this a little bit, and they say, well, but I want bigger. And at what point do we say enough's enough? You don't have the tissues, I'm not comfortable doing this, because the likelihood of complications is simply so high. I don't want to put you in harm's way.
They're driving the issue way too hard, and the plastic surgeon is not standing up and saying what's right, saying that this is too far, this is not going to work, and this is going to make you look odd.
Yeah, I think a little common sense on both sides of the equation could go a long way.
Certainly an interesting discussion. Thank you, gentlemen. For more and the very latest on plastic surgery, be sure to visit theplasticsurgerychannel.com.